I'm Dr. Jonathan Weiler with Weiler Plastic Surgery and Timeless Face here in Baton Rouge, Louisiana. And today we're going to have a conversation or let you guys see a lady named Lori Boswell. Lori first presented to us as a friend of one of our employees who's actually here to purchase some lipstick, and she had planned on having a facial procedure in the near future. She lives up in the Shreveport area, and Lori was simply down here visiting. And me and Lori, we got introduced and started having a discussion, and she became interested in some of the services that we provide here. Lori is a very active woman that's currently works as a lobbyist, so she travels all over the country, is very much the face of her organization, and it was very important to her to maintain her youth and vitality as she ages. And her presentation had become sort of an issue in her life. She felt she was aging ungracefully. So me and Lori started our conversation. One of the things that separates myself and my procedure, I like to name my in-office facelift, I call it a timeless face procedure. And one of the differences that I do that your traditional plastic surgeons don't do is that all of my facial procedures are done under what I term a local anesthesia. Local anesthesia means there's no IVs, there's no tube. We sedate you with oral medication. We typically use some Valiums. We get you to a state where you're very comfortable and very relaxed. And then we numb all the areas that we're going to work on. And this allows us to achieve traditional results using non-traditional methods. And what I mean by that is that we have eliminated the risks of general anesthesia. The risks of general anesthesia as you get older can become quite a factor in a patient's selection of both the procedure and their surgeon. There is an increased risk of Alzheimer's as you go above the age of 60 with general anesthesia. And by doing procedures like this under a local anesthesia, not only do we lower the costs, but we also lower the risks associated with the procedures. So all of our procedures are done in a fully accredited surgical center. They're all done under a local anesthesia. And the results, I think, are comparable, if not better, than your traditional facelifts. We can achieve a very natural, overall, enhanced sort of youthful look in a patient with really minimal downtime. Lori had her procedure done towards the end of the week. We saw her, she stayed a few days around the area, stayed with her friends. We saw her a few days after, everything looked great. And really within a week, she was very appropriate to go out into the public eye. Now I tell patients, party presentable is usually about 2 weeks, depending on what you have done. But Lori was presentable at that 1 week mark.
In March, I traveled to Baton Rouge from Shreveport, and I ran by Dr. Weiler's clinic really to just purchase some fabulous lipstick, which I'm wearing today, and to meet with Megan Hemingway to hear about the aesthetics offered. In talking with her, I shared that I'd already scheduled a facelift in Shreveport. She encouraged me to take a moment to meet Dr. Weiler. In meeting Dr. Weiler, I found a physician who was committed to excellence, who had a passion for his craft, and who had invested in cutting-edge technologies. Dr. Weiler recommended fat grafting, upper and lower eye lift, a neck lift, and CO2 laser resurfacing. He also explained that he would perform these techniques without the use of anesthesia, which was very important to me. The next day I returned home and scheduled the procedure. It's been 3 months, and I feel like I've had great success. My family and friends have all stated that they feel like this is the best facelift they've ever seen. I feel I've had a great outcome because of the support and professionalism of the staff and the skillfulness of Dr. Weiler.